This is the busiest border crossing in the world. Between Tijuana and San Diego, over 100,000 people, cars, and trucks cross every day. There are 2 ports of entry between both cities, and they're both a mess.
Es una vergüenza, con mayúscula, esta frontera que tenemos.
Getting across can take 2 or more hours. The lines of vehicles stretch for miles. But there's something hiding in plain sight at the border. Air pollution. All these idling vehicles are spewing toxic particles into the air for hours on end.
Cruzaba la frontera a pie. Un camión turista se puso al lado mío y entonces yo pensé, todas estas personas que estamos aquí estamos respirando todo lo que ese camión está emitiendo a la atmósfera, ¿verdad? Entonces, ¿qué nos puede pasar?
Carolina Aguilar is a chemist in Tijuana. In 2016, she used a monitor similar to this one to find out how bad the air really was at the border.
Consistió en muestrar partículas que se encuentran en el aire. Se analizó también metales que se encuentran en la atmósfera. Esos metales provienen del escape, son del desgaste de los neumáticos o las llantas, el desgaste de los frenos.
After a year of collecting data, the monitor showed levels of metals and particulate matter that are dangerous for people. Her study found that the average daily emissions at the border don't exceed the exposure limit. But when she looked at the yearly levels, they did exceed the limit by 25%.
Una persona que cruza a diario o ocasionalmente no se ve afectada como una persona que trabaja, en este caso los vendedores de ambulantes, personas que tienen sus locales ahí, la migra o la aduana, que ellos sí están, tienen, que a la larga pueden generar problemas de salud.
That includes Alejandro Gómez Meléndez, who's been working at both border crossings since 1983.
La calidad del aire del smog de los carros es el que sí siento que sí, como que te sientes un poco más mal, pero son ratos, yo me voy. Se sofoca uno tantito y así como un malestar poquito como de edad cuando ando uno mal del estómago poquito.
According to a San Diego State public health professor, being exposed to high traffic areas like the border crossing has adverse health effects.
Lung diseases, like you might expect, increase in asthma, increase in chronic obstructive pulmonary disease, but also effects on the heart and cardiovascular system so that you have an increased risk of heart attacks and stroke.
In one of her studies, Dr. Quintana looked at people who drive across the border every day by placing air monitors in their vehicles.
We found an increased level of certain pollutants inside their vehicles during the idling period. That idling wait period contributed about 2/3 of their total pollution for that commute.
For Quintana, limiting exposure is key.
One obvious solution is to reduce that border wait time.
An expansion project at one port of entry promised to do just that by adding more lanes and processing booths. But it hasn't worked out that way. Half of the processing booths aren't staffed most of the time. And the Trump administration's focus on staffing detention centers has meant transferring staff away from ports of entry. Many commercial vehicles have waited up to 8 hours to cross the border. And all their emissions fill the air near communities on both sides of the border.
Every time these border wait times are going to increase, we know that the community is going to suffer close to the freeway.
Community organizer David Flores worries about the effects on San Isidro residents, like those who attend these schools on the U.S. side.
There's nothing blocking the flow of all those vehicles idling into the playground area of some of those schools because they're right adjacent to it. And so it's not even a block wall or anything, it's just chain link. Those are the major concerns that we have because children's lungs are still developing at that age and can have serious health effects for the future. We were able to document that if border wait times go beyond 90 minutes, that there's an exponential increase in air pollution to the adjacent neighborhoods.
Flores has used air quality data to push government agencies to make a change.
U.S. Customs and Border Protection said our goal is to reach 30-minute border crossing wait times.
Flores just wants them to keep their word.
We want that to be an achievable goal, not just lip service or not just, something that was stated.
In the meantime, for all those crossing, living, and working around these ports of entries, the toll on their health will continue to mount. Reporting from the U.S.-Mexico border, this is Pedro Cota.